You know, a lot of families are very nervous about sending their kids back to school. Would it make you feel any better knowing your school has a telemedicine program with a direct link to a doctor? One district in southern Arizona is promising parents just that.
I think it helps our parents know that as a district, we're doing everything that we can to not only provide instruction, which is our job, but also to look at all of the student and all of that family network.
Santa Cruz Valley Unified School District is proud of its new partnership with Mariposa Community Health Center, rolling telemedicine out to all their schools in the midst of a pandemic before the kids even come back to campus.
We know that students, parents, and even the school nurses, they're going to have a lot of questions for your doctor. So we really needed to devise an easy way that they could contact their physician.
Starting next month, the health aide at each school will get a laptop and all the medical equipment you'd need for a virtual visit with a doctor.
But the cool thing is that we can do pretty much 80% of what we would normally do in an in-person visit via telemedicine, meaning that we can listen to the heart, we can listen to the lungs, we can look in the ears and the throat, we can look at skin. We can do pretty much everything.
This is especially powerful in rural areas. It keeps the kids in class and parents at work. The hope is this telemedicine program will increase accessibility and early interventions with behavioral issues as well.
Sometimes we have those what we call students the frequent flyers that like to go to the nurse because they may have a social emotional issue, and this allows us to have actually a doctor ask some of those questions and then transition that into our counseling department.
This whole child approach to education is more critical than ever before as educators and families cope with COVID-19.
So we're doing a lot of positive things that continue through the pandemic to try to meet the needs of our students so that they can learn.
Mariposa Community Health will be supplying all the equipment and the training, and each visit will either be billed to each individual family or covered with a sliding scale so no one will be turned away.